Actually, the monkeypox was first identified in 1958 in the laboratory. There was a monkey, actually it's imported from Singapore to Denmark for the research of the poliovirus. And the researchers got some rash symptoms. So that's the first monkeypox cases in the world. The virus is the same family of a virus as variola virus. That variola virus is the virus that causes the smallpox. And it has to be mentioned that the monkeypox does not have related to the chickenpox. So the first cases was transmitted from the research animals to the laboratory technicians in Denmark, Copenhagen in 1958. But actually, most of the monkeypox, the most suspicious reservoir of the monkeypox virus actually is rodent. There are 59 cases reported between 1970 to 80 in West Africa and Central Africa. And then the mortality rate is as high as 70% in children under 10. So this is one of the first few literatures that report the human monkeypox. From January to May 2022, most cases of a monkeypox actually occurred in the Republic of Congo of the Central Africa. And the outbreak actually caused about 1,200 cases and 58 deaths. So the monkeypox, it's kind of like the zoonotic orthopox virus. It means that the virus natural host is in animals, but due to some close interaction between human and animals, so there are some spillover virus, and they start to learn how to adapt to human environment and become a human disease. Let's talk about some virology of this virus. It is a DNA virus, so it is not like a SARS-CoV-2, what is the cause agent of the COVID. RNA virus has a very rapid mutation rate, but the DNA virus is much more stable than the RNA virus. And it belongs to the family called Paxiviridae, and is the same genus as variola, as I mentioned before. Before this outbreak, there's two strains. The clade one is in the Congo Basin, which has higher mortality. The clade 2 is in West Africa, which is milder diseases. And currently, we probably have the third clade. So the third clade, virally, from the sequencing perspective, this is more like the Nigeria strain outbreak in 2018. And when we check the sequence of a virus, the scientists discover that the mutation sites actually are more than expected. So we can say that the virus is accelerating to the human adaptation. So that's a warning sign. And let's talk about the current outbreak. So the first clusters actually was found in UK, but currently the source of this cluster is still unclear. Although there's one British people, he traveled to the Nigeria and come back to London, but later they analyzed the sequence of the virus and found the cluster was unrelated to the people who come from Nigeria. Then Several countries reported that they have monkeypox in Europe, especially from the Portugal or the Spain and Italy. So that become not only a local endemic, but they will transmit from people to people in multiple countries, multiple sites. That caused the attention of the WHO. So the WHO announced that there is a single or multiple country emergency require major massive pandemic response, listed as the grade 3. Let's check the latest data from our own data. So the confirmed case is about 41,000 as of August 22, 2022. That means the cumulated cases. But there are some good news. If you can see that the daily confirmed cases, actually the trend has been turning down. That means our current containment, for example, the isolation, the vaccination, and the drug take some effect. So this is good news that the epidemics did not grow indefinitely. And this is the data from the US CDC. They map out the major outbreak area in the world. Currently there are 97 countries which reported the occurrence of the monkeypox cases. The largest case numbers comes from the United States, and you know that there are some more densely reported areas are from Europe. In Asia, we can see that the South Asia, like the Thailand, Philippines, Indonesia, Japan, and Korea, Taiwan, India have reported cases. And fortunately, this outbreak is not like the previous one. The mortality rate actually is only 0.2%. Up to date, there's only 96 deaths in total, but as compared to the 40,000 of cases, so the case fatality is below 1%. So let's briefly summarize some basic facts of the monkeypox. The incubation period is around 9 days. The R0 among the men sex with men is 2.43. We know that the R0 means how many people that one infected people can transmit it to. For example, the BA.5 of the Omicron, the R0 is about 10. So compare with the Omicron BA.5, the transmission ability of the monkeypox virus is only 1/5 of the SARS-CoV-2 virus Omicron strain. And the disease is typically self-limited, and the disease course is between 2 to 4 weeks, with a hospitalization rate of 13% and case fatality rate of 0.2%. The first 3 days, there may be some symptoms. First, about some people will have fevers, and many people reported they have headache, and they will have some chills or musculoskeletal pain, and they will have some malaise, fatigue, and some people will have swollen lymph nodes. So this is a more precise statistics on different symptoms. About 76% will have fever. So not all people have fevers, but all people will have the rash and headache and swollen lymph node. The percentage is around 65, and fatigue is around 73%. So these are the general symptoms. Some people may have some atypical symptoms like diarrhea, vomiting, and respiratory symptoms such as cough or rhinorrhea. This is the usual presentation of monkeypox, but there are some specific, unique skin manifestation in this outbreak. Some people will only have the genital and anorectal areas or in the mouth, but the rash do not appear in the typically in face or palm and sole. So the clinician need to keep highly alertness that if you have lesions only in genital and anorectal areas, that also is a presentation of the current outbreak. And the rash is not always disseminated across many sites of the body. And the rash may be confined only to a few lesions, or only a single lesion can justify the diagnosis of a monkeypox. And the rash does not always appears on palm and sole, and lesions often described as painful until healing phase when they become itchy. So, and also in this outbreak, many patients report that they have rectal symptoms. For example, there will be purulent or bloody stools, rectal pain, or rectal bleedings. So this unique manifestation is different from the previous endemic monkeypox. So there are some routes of transmission. One is the interaction between human and animals. Most of them are rodent. So if a bite or scratch from the rodents or monkeys, or you eat the bush meat that is raw or not completely cooked, then you probably will get the virus. For the human-to-human transmissions, first, a close skin contact will transmit the virus, or the respiratory droplet will also cause the transmission. But it is still not airborne or the aerosolized transmission. It's only the respiratory droplet in short distance. Vertical transmission is also likely. But many of the patients report that they have a hug or close skin contact with patients who later develop monkeypox. If you look at the age and gender distribution, you can see that male are predominant all cases of the monkeypox, and the age distribution is between 20 to 50, with the highest incidence in the age group 31 to 35. Although there are lots of information that they do not want to coin monkeypox as a sexually transmitted disease, the basic fact is that 98% of the monkeypox patients are MSM, men, sex with men. So it is already known that oral, anal, and vaginal sex, or touching the genitals or anus of a person with monkeypox will contact monkeypox. hugging, massage, and kissing. Prolonged face-to-face contact or touching fabrics of objects or objects during sex that were used by a person with monkeypox that have not been disinfected, such as bedding, towels, fetish gear, and sex toys. So unsafe sex is at high risk. There will be close skin-to-skin contact or anonymous sexual contact with multiple partners. These are risky behaviors for monkeypox infection. So for prevention, we want to encourage safe sex. We also need to take some precautions when you have close contact with a patient with monkeypox, and you also want to reduce the interactions between animals or do some trading of the exotic animals. So there's a heated debate on whether monkeypox transmission is airborne. Currently, there's no cases of a long-range airborne transmissions. But when you do the change of the beddings that a patient with monkeypox have been slept, then it is likely that the virus particle will aerosolize. So if you want to clean the environment, the beddings of the clothes of a patient with monkeypox, you need to take precautions like the N95 masks and gown and gloves. So for the mask, currently it is only recommended to people close contact with infected people. So long distance or in the same room, you do not need to wear mask unless like the healthcare providers or like the officials, you need to have a very short distance, face-to-face, a close contact with the infected people, you need to wear mask. For laboratory test, we rely on the PCR. So the patient evaluate monkeypox by healthcare provider if they have very characteristic skin lesions and have the contact histories, then they need to send the specimen to do the PCR. And if the PCR turns positive, that's the probable cases, and need to do isolations or do the post-prophylaxis vaccinations and start treatment. For the PCR interpretations, the CT number less than 40 are the criteria to diagnose a patient with the monkeypox. But the true positive is cut off the point, threshold point is 37. For the patient with a CT number between 37 and 40s, the results is inconclusive. So it depends on the clinical diagnosis. So for the vaccines, the preferred vaccine are the Genius. It is a 2-dose vaccine given 28 days apart, and the immune will reach its maximum 14 days after the vaccinations. The other alternative vaccine is the ACAM 2000 vaccine. It is a single-dose vaccine which is administered at 4 weeks apart. The ACAM 2000 vaccine is for smallpox, and it has more adverse effect than the Genius vaccines. So it is attenuate viral vaccine, so it is not recommended for weakened immune system. So this is a direct comparison between the conventional smallpox vaccine, which we called ACAM 2000, and the newly developed Genius vaccines. So for the ACAM 2000s, the vaccine virus is replication competent. So that means the virus, when you get administered of these vaccines, the virus actually replicate in your bodies. And for the Genius vaccines, it is a replication deficient modified Vaccinia ankara. So for the ACM, you have to take, I will show you some pictures. And inadvertent inoculation and auto-inoculation risk exist for the ACM 2000, but there's no risk for the Genius. And serious adverse effects are more reported from ACM 2000, but very few adverse effects reported from the Genius vaccines. There are some mild pericarditis reported in the ACAM 2000s, but still there are risks for mild pericarditis for Genius vaccine, but the risk is believed to be lower. For the effectiveness, FDA assessed by comparing immunologic response and take rate to the dry vax. Actually, for the current report, for the current outbreak, we do not have much data to compare the effectiveness of these two types of vaccines. The vaccination, if got possible exposures, you can get a post-exposure vaccinations within 4 days. That is effective for preventions. And we have a drug for the monkeypox, which is approved by FDA in 2018. The drug is called tecovirimat. It has oral or IV form, or you can call it as a T-pox. And it has a favorable clinical and safety profile. The mechanism is inhibit F13L gene, which is produce the P31 protein. This protein is not for viral replication. This is for viral spread from cell to cells. So let me use this picture to show the mechanism of these drugs. So the mechanism of the drug is that it blocks the process of IMV to IEV. IMV is the intracellular immature virus, IEV the intracellular envelope virus. So it blocks the virus to form envelope. So it will block it from the transmission from cells to cells, but not inhibit the replication of the nucleic acid. The drug needs to adjust based on your weight. And the use is that you need to carefully open the required number of capsules and mix content of capsules with 30 milliliter of liquid. For example, you can mix it with milk, chocolate milk, or soft food such as applesauce, yogurt, and administer the entire mixtures within 30 minutes of preparation. And for the IV, it also has to adjust to your weight. Normally, it's given at 200 milligrams every 12 hours by IV infusion over 6 hours. And there are some preliminary reports on the treatment results of the tecovirimat. The UC Davis report that there's 25 patients experienced that 40% have complete resolution on day 7, and 92% have complete resolution by day 21. And there are a few non-specific adverse events. For example, 28% report fatigue, 20% report headache, and others such as nausea, itching, and diarrhea. The drug and vaccine availability in Taiwan, the Taiwan CDC announced that they have obtained the tecovirimat for 504 people, which should be arrived on August 27. And for the Genius vaccine, it is still in the contracting process, but expected to arrive by the end of August. So this is the last slide I want to share with you, that we are in the foreseeable future, we still will have lots of challenge of zoonotic viruses. And the most important thing is that we need to detect them earlier and do the isolation containment, because when the virus detect later, they will start to adapt to human. Once they adapt to the human environment, the transmission speed will be accelerated, and you will have great risk to become a pandemics.